Good afternoon, everyone. Hope you've all enjoyed your day so far. My name is Debbie Dixon. I'm with the Foundation Fighting Blindness, and I actually head up one of our fundraisers called Ride for Sight, the motorcycle charity ride that is moving into its 35th year in 2013. So I'm very pleased to be here today, and it's been a joy to get to know some of you and share some of your stories and help you out where we can help you out. And I hope you've all been finding it very informative and that you've all been able to make some new friends while you're here too. This is our final breakout session of the afternoon. It's breakout session B, Nutrition and AMD, and it is with Dr. Nupura Bakshi, who's beside me here. And Dr. Bakshi is an ophthalmologist and retinal specialist at Mount Sinai Hospital and St. Michael's Hospital in Toronto. She completed a fellowship in medical retina and age-related macular degeneration at the National Eye Institute in the U.S. with Dr. Emily Chu, principal investigator on the age-related eye disease nutritional studies. Today, Dr. Bakshi will tell us about the foods and vitamins recommended for people living with age-related macular degeneration. Without further ado, as time's ticking away, and I know you're all very much looking forward to hearing what Dr. Bakshi has to say, I'd like to now introduce Dr. Nupura Bakshi. Welcome.
Good afternoon. It's a pleasure to speak with all of you. So essentially we'll talk a little bit about vitamins and nutrition and macular degeneration, and then you'll have an opportunity to ask me any questions you like. So first, I guess I just wanted to address, why is nutrition even relevant in macular degeneration? I think that's the first question. So really, we all know that macular degeneration is a leading cause of vision loss, and there are many treatments that are available, but they focus on the advanced type of disease or patients who have wet macular degeneration. We don't really have a lot of a lot of treatment now that helps to prevent the disease or help to treat earlier forms of the disease. So nutrition is really important because anything we can do to reduce the burden of illness, to reduce the effect both on the person, the family, and society has a huge impact across the board. And nutrition and methods of prevention of disease progression are really important. So why do vitamins help with eyesight or nutrients? So we're going to focus, I mean, there's 100 different nutrients probably that you might have heard on the internet or have a relative take for or whatever, but we're going to focus on the big ones where there's more evidence in the literature. So we're going to look at vitamin A and beta-carotene, omega-3 fatty acids, vitamin E, zinc, and antioxidants. And since these are the ones that are kind of been more studied. So for vitamin A, the reason that it's helpful is because it's kind of the precursor or the parent of a molecule that's involved in the process of transforming light into an electrical signal. And beta-carotene is the dietary intake component that is converted into vitamin A by the body. So the next thing, omega-3 fatty acids, or DHA, those are essential fatty acids, meaning that we have to take them from our diet because our body doesn't make them. And those are important parts of the membrane of the cells that are responsible for vision, the photoreceptors. So typical diets or healthy diets should contain a good balance between omega-3 and omega-6 fatty acids. But the typical North American diet is much heavier in omega-6 than omega-3. So if you think of a Mediterranean diet where people eat a lot of fish and healthy vegetables and olive oil, that is a more omega-3 diet. But if you think of the, let's say, the typical American diet or fast food or McDonald's diet, that is an omega-6 diet. So certainly focusing more on omega-3s, either through your diet or as a supplement, has also been found to be helpful, and we'll talk a little bit more about the evidence later. So antioxidants, why are antioxidants helpful? So antioxidants are helpful because the area where the photoreceptors are, the cells that are responsible for vision, they're in the outer part of the retina, and that area has a lot of oxygen. And so when you have a lot of oxygen, you can get what's called oxidative stress. So the oxygen causes these little molecules called reactive oxygen species to develop, and those cause damage to the cells. So antioxidants essentially help prevent this. They prevent you from rusting. So in a basic way. So lutein and zeaxanthine are two important antioxidants, and they make up a lot of the pigment that's found in the macula. And they also help to absorb blue light. So blue light has been shown to cause damage to the macula. So lutein and zeaxanthine are helpful. So you might, anybody who's heard, gone to the drugstore and looked at any of these supplements for macular degeneration will always see lutein on everything. And that's the reason that, lutein is so popular. So, and finally, B vitamins as well. So B vitamins have a kind of indirect way in helping the eye. They affect the metabolism of this molecule called homocysteine that affects the blood vessel layer in the eye. So studies have shown, and we'll talk about that a bit later, that B vitamins can also be helpful. So I'm sure your big question is, how do I get these vitamins? So always, we'll talk about the evidence in terms of supplements, but the first and most important thing is your diet. So for vitamin A, good sources of vitamin A include green and yellow vegetables, and these are converted from beta carotene, and liver, egg yolks, and as well as things like margarine. And so those are all good sources. A primary source, really green leafy vegetables and green and yellow vegetables. So for omega-3 fatty acids, it's found, DHA, which is the main one, is found in cold water oily fishes. So cold water oily fish include things like salmon, herring, anchovies, mackerel. And the reason that these fish actually have high levels of omega-3 is because they eat algae that have omega-3. So if you don't eat fish, or you're vegetarian, you don't like fishy burps when you take these pills, for whatever reason, you can also take an omega-3 supplement that comes from algae, because that's how the fish got it, is from the algae. So, and also flaxseed oil, hemp seed oil, chia seeds, all of these are also sources of omega-3, but they are a source of a different type of omega-3 called ALA. And ALA gets converted into DHA, but not as much. So you have a much greater source of DHA if you eat something that has an algae source or a fish source than if you eat flaxseed. So antioxidants, there's many different antioxidants. So for vitamin C is an antioxidant. I think we all know about that one. Get your orange juice when you have a cold. That comes from citrus fruits and vegetables. Vitamin E is also helpful. It's found often in nuts and vegetable oil, green leafy vegetables as well, and in some fish. And lutein and zeaxanthine, the antioxidants that we had discussed earlier, are found in green leafy vegetables. So not romaine lettuce. We mean like kale, Swiss chard, collard greens, spinach, dark green leafy vegetables. And they are found in carrots, but actually less. So I know that there's always that colloquial statement: if you eat carrots, you don't have to see your eye doctor. It's not totally true. So yes, there are some nutrients in carrots certainly, but the antioxidants are found much more in green leafy vegetables. So the major studies, so what is the evidence that these things are helpful? What are the studies that, even told us that we should have a healthy diet and why we should take these supplements? So there is a supplement that's marketed for macular degeneration, and that is based on a study called the Age-Related Eye Disease Study that was a multi-center study mainly done in the U.S. And that looked at specific doses of vitamins and nutrients. And what they looked at is they used 500 milligrams of vitamin C, 400 units of vitamin E, 15 milligrams of beta carotene, 80 milligrams of zinc, and 2 milligrams of copper. And they found that actually reduced the chance of vision loss, of severe vision loss, by 25% over 5 years. So 25% reduction in vision loss is pretty good for a vitamin. So, can you repeat them? Yeah, sure. What's in it? Yeah, sure. Vitamin C. Yes, vitamin C, vitamin E, beta carotene, zinc, and copper, cupric oxide. And the point of the copper was just to reduce anemia from zinc. It wasn't because it actually did anything by itself. So, oh, sure. You can certainly find this information easily if you Google it. But it's 500 of vitamin C, 400 of E, 15 of beta carotene, 80 of zinc, and 2 of copper. And milligrams for everything except vitamin E, which is international units. So essentially, it showed that it reduces the chance of severe vision loss by 25% over 5 years, but only in select patients. So I know I see many patients who have macular degeneration, and a lot of them have heard about these vitamins, or you see it in the drugstore and they start taking them. But you should not take it unless the doctor suggests that you should. And the reason for that is because the study only showed it helped in a select group of patients. So patients where it helped were ones who had intermediate AMD or advanced AMD in one eye. And what does that mean? That means intermediate AMD means that you have a certain size and number of the drusen deposits, the little yellow spots in the back of your eye. So if your doctor says you have early macular degeneration, then the vitamins had no benefit. If your doctor says you have advanced macular degeneration in both eyes, the vitamins also had no benefit. So it really helped the middle population of patients who already had enough degree of disease that they were at significant risk of it getting worse. So that's an important distinction, because I think a lot of patients, you don't know, it says macular degeneration, you're like, well, I have macular degeneration, I'll take this vitamin. Or you might say, oh, well, my father has macular degeneration, so I should take this vitamin. That is not the case. So you really should only be taking the vitamin if you have intermediate macular degeneration or advanced in one eye. And you can find out this information from your eye doctor. So, okay, so, and essentially, what are the other reasons to be careful? You might say, well, okay, fine, it only helped in this group, but why not just take it anyway, just in case? So the vitamins have side effects. These are high doses of vitamins. This is not the dose that's found in a multivitamin like Centrum. These are high doses of vitamins. So the intake of beta-carotene was found to increase the rate of lung cancer in smokers. So if you smoke, and even if you have macular degeneration and you should be taking the vitamin, if you're a smoker or a former heavy smoker, you should not take the one that contains beta-carotene. So it will say specifically on the package that it's meant for smokers. So also, the zinc caused problems with urination. It caused enlargement of the prostate, urinary tract infections. So that's another reason to, not take it willy-nilly. And also, there are some studies that show that a high intake of vitamin E might be associated with prostate cancer, and the high intake being the same dose that's in the multivitamin. Other studies have shown that that's not the case, but we don't know for sure. So those are the reasons that, you need to actually take it if you need to take it and not just take it just in case. So now that formulation was based on the first study called AREDS-1. Now there's a follow-up study called AREDS-2 that is still collecting data, and the results are not out yet. And the difference with AREDS-2 is a few things. One, they decided to add lutein and zeaxanthine in, and they also decided to add omega-3 fatty acids. So until the results of AREDS-2 come out, we don't actually know whether lutein and zeaxanthine and omega-3 fatty acids are actually helpful. We think they probably are, based on dietary studies that looked at people who have healthy diets and said, oh, well, these people have less chance of developing macular degeneration. What did they eat? But we don't have a randomized clinical trial, meaning where you take patients, one group is the blind group that takes a dummy pill that has nothing in it, and one group is the group that takes the pill with the medication, and the groups are otherwise matched, and you see what their rate of macular degeneration is. So that's a randomized clinical trial. And so the only randomized clinical trial is the AREDS study. So the results we're hoping are going to come out probably in 2014, but until then, we're just hoping that they help, but we're not really sure. So AREDS-2 will look at omega-3s, will look at lutein and zeaxanthine, and it also is trying to reduce the dose of zinc in the medication, because they're thinking the dose was too high and it caused some anemia in patients. And they're also trying to get rid of the beta-carotene and see if it made a difference or not. So there's a few little variants in the AREDS-2 study to see what is actually the best formulation. Now, if you go to the drugstore, you'll see that all of the companies have already marketed for the AREDS-2 study. So if you go and try and buy the supplement, they all contain lutein and zeaxanthine. A lot of them contain omega-3s, and it actually says AREDS-2 on it already. But what you have to keep in mind is that study's not even out yet. We don't have any results from the study. The drug companies are assuming that it's going to work based on other, general studies looking at dietary intake, and they've already marketed all the products. So just keep that in mind when you're in the drugstore looking at all those products, and we'll talk about that a bit more in a minute as well. So as I was saying, so there's many studies looking at dietary intake of lutein, omega-3 fatty acids, vitamin C, etc., and those have shown to have a reduced rate of developing macular degeneration or of macular degeneration getting worse. But it was not based on taking a supplement. It was based on having a healthy diet. So that's why I'm saying, first and foremost, a healthy diet is the most important thing. So as well, there was one study that looked at a supplement of B vitamins. So they looked at 5,000 people, and they gave them vitamin B6, B12, and folic acid, and it was actually a cardiovascular disease study. So they were looking at the rate of heart attack and stroke in women. And they decided, well, as a side, since we're looking at all these people, why don't we see what happens to their macular degeneration? And that study showed that out of the small percent of patients who actually had macular degeneration, that there was a decreased rate of developing by 35 to 40% if you took the vitamin B12 and B6 and folic acid. The only limitation with this study is that they didn't have an eye exam. So they were based on the patient saying, like ticking a questionnaire and saying, yes, I have macular degeneration. And we all know, not if the doctor's not looking at it, there may be patients who don't really have it, or patients who really have something else. And so it was based on a self-report by patients. You have to take the result with a grain of salt. But there is a possibility that B vitamins might help to reduce the progression. So, my next topic I wanted to address is, what do you do when you go to the drugstore and you see 1,000 different vitamins? I went myself to Shoppers Drug Mart the other day, and I counted 30 different bottles and of different vitamins by different companies, and I was confused, and I'm an eye doctor. So I can only imagine if a patient is going and looking at these and saying, oh my goodness, which one should I get? So I think the important things to consider are, one, you want to make sure that the basic components of the AREDS 1 study, which were what I mentioned earlier, the A, C, E, copper, and zinc, are in them. Then all the other stuff, some of them have blueberry extract, some have lutein and zeaxanthin, some have omega-3s. All of that stuff, we don't know yet if it works. We're hoping that it does, but we don't know yet. So there are the Vitalux supplement, that's one of them. It's produced by Novartis. That has a lower amount of zinc in it. The Ocuvite, which is produced by Bausch & Lomb, has more omega-3. And almost all of them that I saw, almost all contain omega-3s and lutein and zeaxanthin, even though AREDS 2 is not out yet. So, is it going to hurt you? Probably not. Do we know if it helps? We don't know yet. So just keep that, keep that in the back of your mind when you're looking through the pills. If it does not say AREDS on it, then don't even bother looking at it, because there are a lot of homeopathic other medicines and all kinds of herbal vitamins that are meant for the eye that are not the ones that are studied. So at least go for one that says AREDS on it, but just keep in mind that we don't know if everything in it is helpful yet, and then some of the doses of zinc and beta-carotene vary between the different medications. And of course, if you're a smoker or a former heavy smoker, you should take one that does not contain beta-carotene. So out of the two big brands, that's Vitalux S, meaning S for smokers, or Ocuvite Preservision, which does not contain beta-carotene. So my other question, which a lot of patients ask me, is what do you do if you have a family history of macular degeneration, or you have very early macular degeneration? The doctor said, oh, there's a few little spots, you have very early macular degeneration. For this group of people, the ARED supplements is not of any help. So don't go and get those vitamins, because they're not going to help you. And there are those side effects that we talked about as well. For patients who have early macular degeneration or a family history of macular degeneration, the things that are important, they're really important for everybody, really. Take just a regular multivitamin like a Centrum. You're welcome to, take whatever naturopathic medications you want to, but if the things that are found to be helpful, just a regular multivitamin, and having a healthy diet. So what's a healthy diet? Green leafy vegetables, colorful fruits and vegetables, having 2 servings of fish a week or some other source of omega-3 fatty acids. Also having lots of fruits and berries. Berries also have a lot of antioxidants. And avoiding high fat and processed foods, so like the McDonald's diet, avoiding that type of a diet. And being physically active, wearing UV protection sunglasses when you go outside and it's sunny. So not just, cheapo sunglasses, but one that has a good UV filter inside it. And also making sure that your regular health is good, that your blood pressure is good, your cholesterol is good, because this will protect your heart and your eyes. And also seeing your eye doctor on a regular basis to make sure that you're monitoring any progression in the macular degeneration. And along with that goes the Amsler grid. I'm sure anybody who has macular degeneration has heard of that. It looks like a little piece of graph paper, and it's something you use to look at one eye at a time to see if you're seeing any new spots in the vision that might show that the macular degeneration is getting worse. So there's no proof, just to reiterate, there's no proof that any supplements help for patients who don't yet have macular degeneration. So we hope that there may be some help based on dietary evidence, but we don't know yet that any supplement does. I know that some of the companies do market a supplement that's supposed to be for family members of people with macular degeneration, but if you have a healthy diet, then you don't need to take it. If you find that you have a really horrible diet and you just can't get green leafy vegetables and you have tea and toast or meat and potatoes all day, then maybe that's something to consider. So the other question that patients always ask me is, what about all those other supplements? So, they things like blueberry extract, different, chia seed extract, barberry extract. And there's 1,000 different things that are found in the drugstore these days, especially, in the natural section of stores like Whole Foods. So they probably don't hurt. We have no idea if they help. So it's really up to you. So as long as you're not doing yourself any harm, you're certainly, welcome to try all of those things. And those would be things like acai berry extract or the extract from red wine or fruit and berry beverage extract, so lycopene. They're all different antioxidants, and we just don't have any evidence to see if they help in macular degeneration. That being said, probably if you're taking them, within a normal dose, you're not going to cause yourself any harm by taking them. So that pretty much, perfect timing, so that pretty much ends my talking portion of the session, and I'd just like to open the floor up to your questions. If you have anything to ask, whether it's related to nutrition or not, but focused on macular degeneration.
You mentioned too much zinc can cause urinary problems. What kind of urinary problems?
So it can cause urinary tract infections and prostate enlargement and kidney stones.
How much should you take if you take zinc? Because it's supposed to be good for other things.
So the dose that was in the initial ARID study was 80 milligrams, and then in the ARIDS 2, they're dropping it to 25. So if you look at most of the supplements, they actually have close to 25. So Vitalux has 25, but Preservision has 69, I think. Oh, if you're just taking it in, it'll be much lower. If you're just taking a regular over-the-counter multivitamin, yeah, it'll be much lower than that. Oh, then it's totally variable based on the form of zinc and the pill that you're taking.
Hi, doctor. Thanks for your information.
Oh, no problem.
I had a question. There was a Dr. Chater earlier. I was listening to him speak, and he mentioned about something called Retinal Complex. And he said it was something that presently was only, you could buy it online. It was from some company in the Netherlands. He suggested it was something that was getting good results.
So that's a hard question to answer. What I can say is that what we know on the evidence now is really the only study is the ARED study and that vitamin B study that I mentioned. There are plenty of groups, especially in Europe and Asia, where like their regulations on some of these tests is much broader, and they don't seem to have the same degree of regulation, and they have all kinds of supplements, and I have many patients who order these things from like Sweden and stuff. Do I know if it helps? I have no idea.
Okay.
We just don't have the evidence.
Hi, I actually have RP, so I'm not here as an imposter, but I was told when I was picking my sessions that the vitamins that would help people with MD will also be applicable for people with any, in general, with any retinal degenerative disease. So how would you comment to that?
So it's a little bit, I mean, that's partially true, but not fully true. So it depends on the dystrophy. So, for example, in patients who Stargardt's, they should not be supplementing with vitamin A because vitamin A is actually found to increase the deposits in their eye. There are some studies that show that vitamin E might be actually detrimental in patients who have RP. There's other studies that show that vitamin A with omega-3s and lutein is helpful in RP, but then other studies that show it didn't make a difference. So I think macular degeneration is a little bit of an easier answer where we have clear evidence that it helps, and there's every study kind of shows it helps. In RP, there's some studies that say yes and some that say no.
So what did you just say, vitamin E?
Yeah, vitamin. Yeah, avoid, yes. And then another study there's a study that came out recently. The information's on the Foundation Fighting Blindness website, combining vitamin A with lutein and omega-3s, and they found that reduced, they said it gave you 20 more years of useful vision, however they qualified that, but essentially that it caused less loss of vision than not having anything.
But you can eat as many foodstuffs.
Absolutely, absolutely. Yes, because even if you're not supposed to have vitamin, a particular vitamin, if you take, like for example, if you take beta carotene in, its conversion to vitamin A in the body is very regulated. So even patients with Stargardt's can certainly go eat beta carotene without, fruit or whatever, carrot or whatever, without worrying. The one for RP? Yeah, omega-3s, vitamin A, and lutein. Yeah.
You mentioned Aries Test 1 and Aries Test 2.
Yes.
Is this marked on the containers?
Yes, it is marked on the containers. Probably most of them now will say AREDS 2 because, as I said, the companies have already jumped the gun and started marketing for the study that's not out yet.
And how is that spelled?
AREDS, Age-Related Eye Disease Study.
Thank you very much.
It's just a comment. I was listening to the radio the other day, and they were actually talking about orange juice. And the guy said, don't drink orange juice. He said, have an orange. And you mentioned vitamin C and drink orange juice. You're going to have everyone with a sugar high.
No, sorry. I meant to say that when people say when they get a cold, they drink orange juice, everyone knows vitamin C is in orange juice. But I agree with you 100%. The best source is the natural source. So without having a processed vitamin C, it's better in juice. It's better to have the orange instead.
Dr. Chater mentioned vitamin B. Mm-hmm. You mentioned vitamin B. What type of vitamin B? Because
it's folic acid, B6, and B12.
Thank you.
A little complicated, but on your studies for your REDs and the stuff that the surveys they did said that the vitamins helped. The study was done on mid-range macular degeneration. Yes. And the studies were not done at beginning, early stages, and they weren't done in advanced.
They were done, just it wasn't shown to be helpful, that's all. When they did the AREDS study, they took patients from early through to severe. So I was an investigator on the study, so I saw a lot of these patients. They took them through from early through to severe, but the benefit was only shown for the middle group.
Okay. Could I just ask the zinc, what is the normal recommended dose just in general,
I'm not sure. I don't remember what our recommended daily allowance is.
So that 15 milligrams is really way up? That's what you're saying?
80 milligrams, yeah. 80 and then 25 is way up.
I'm a little bit confused about the Vitalux. Mm-hmm. I've been taking 2 morning and night, like 4 a day. Is that wrong?
So it depends on which Vitalux you're taking. So I have a little chart here that I looked up.
I have the Vitalux with Omega.
Yeah, so the Vitalux with Omega is 4 capsules, but the regular Vitalux before was just 2. So the Omega one is 4.
Okay, because of the Omega.
Yeah.
I see. Just as an aside, they only give you enough for half the month. Mm-hmm. Like we need to have 120. They only give you 100. Why is that?
That's a darn good question. Probably has to, exactly.
It's really expensive.
I agree with you. It's very expensive.
Yeah.
There is no doubt about it. The supplements are very expensive, and I'm not sure if any of the reps from the companies are here today. They might be a better person to ask. Oh, yes, we've got one right there, but not from Vitalux. So they are very expensive. There's no doubt about it.
I'm just curious that, is this working? Yes. I'm just curious that they can put these vitamins on the shelf. They're renewed, the ones that are now with omega-3 and all that sort of thing, and say that they're the result of the ARED study when it hasn't been completed.
So they're not saying it's based on the results of the study. They're just saying that they're using the formulation that's in this study, which they're allowed to do. Supplements are unregulated. It's not like a drug, like you can't market Percocet like that. I mean, it's not a regulated industry the same way that, medications are. So they're basing it, they're saying that the formulation is the same. And probably if I had to extrapolate out to what the results are going to be, it's going to show they're helpful, because that's my suspicion based on all the evidence that's out there so far. But that's the reason that they are able to market it, because they're not saying that, oh yes, the study has proved it. They're just saying we're using the same thing as what's in the study.
But I'm sure there are not many people who understand that.
You're 100% correct.
I'm taking Vitalux, and in addition I am taking lutein. Can I overdose on lutein? Because it's 20 milligram.
So are you taking Vitalux that has
Vitalux,
lutein?
5 milligram of lutein, and then I take an additional pill, lutein only, 20 milligrams.
So you can take it, but even the AREDS 2 study is not looking at that much lutein.
But I can't overdose it. There's no.
Well, you might.
harm.
I mean, if you were starting to overdose, you would start to turn yellow a little bit.
Okay.
So probably not. But I don't know that there's much point to taking that high a dose.
What about vitamin B complex?
Yeah, B complex usually has all the other little. B complex means it has all the little B vitamins in it. Any other questions? I know it's very confusing. It's confusing as a doctor, let alone as a patient. And hopefully once we have more clarity from the AREDS 2 study, then it'll be easier to know what supplement to take, so there won't be as much variability in what's available in the pharmacy. But if you have any questions, just bring your medication into your doctor.
Just one question. We often encourage to eat a lot of colored things, and
yes.
But all these minerals are coming from the soil, and the soil could be depleted. So maybe what you're eating, there's nothing in it. Let's say spinach grown in the same area year and after. Then maybe it's only green, but there's no any vitamins in it.
I don't think that's necessarily the case. I mean, we've shown from decades of people eating, like if you look at some of the studies, everybody lived in the Mediterranean and they just had produce from that area over and over, and they still had all the nutrients. So it's not totally dependent on the soil. Certainly, whether you want to buy organic or not, I mean, that's your own personal choice, but I think they still have nutrients.
What about tomatoes? I've heard they're high in lutein.
Yeah, so tomatoes are also high in lycopene, especially, even more than lutein. It's lycopene that's a big ingredient. It is certainly a powerful antioxidant. It's been studied in cancer and osteoporosis, but it hasn't really been studied in macular degeneration. I don't think it can hurt you, but we don't know specifically for macular degeneration.
How much of a factor is the ultraviolet light from the sun?
Sure. Yes, certainly we know that ultraviolet exposure, UV exposure, has been shown to worsen macular degeneration and incidence of macular degeneration, so that's why we do recommend people wear sunglasses. And we recommend that in retinal dystrophies as well. So there's certainly a component from UV light.
So I had my glasses tinted, but I had the first set of glasses were tinted gray. And then I read or heard on the radio on BBC that it was the blue light. And I'm thinking, well, gray isn't going to really filter out blue light. So I talked to my optician, and she retinted them kind of yellow-brown. So which is better? Which
so
one is better?
there's a difference between UV and just blue light. So you could have gray glasses that are still a UV filter. So you can have clear glasses that are a UV filter that don't have any color in them at all. So that is a separate issue. But yes, blue light has been shown in some studies to affect macular degeneration, although it's not 100% for sure that it's based on exposure levels. If you're walking around, it might, studies are looking at high levels of exposure. Certainly can't hurt.
So ultraviolet is not the same as blue light then? Is that
No,
what you're saying?
so you can have ultraviolet colored protective glasses that are clear. They don't have any color in them at all. So most of the time people think of ultraviolet protection as sunglasses, but you can have very, very, very lightly tinted sunglasses that are almost no color that have a UV filter in them.
But what I'm saying is the UV light from the sun is different?
The blue light is one of them, but it's not everything.
Okay, so just the ultraviolet and
Right.
blue are
Yeah,
different.
they're just different spectrums of light that are emitted. It's just a spectrum of radiation of light.
Okay, but they're all kind of harmful.
Yeah, exactly.
Now, and I just, sorry, one more question. What about the dial on your on your bedside clock radio? It's kind of green and it's very bright. And mine was like about 2-3 feet from my head, and I now have it at the foot of the bed.
I don't think that would cause any problem.
That's not going to, okay, because it's
we shine lasers that are green in people's eyes.
Right? But that's radiative, and it's like day after day.
No, I mean, we shine a green laser light in people's eyes, and they're okay. So, right in their eyeball. So don't worry.
What about computer light?
No, that's fine also. That's fine.
That's fine?
Yeah, absolutely.
So television and computer lights
no
fine?
problem.
So the way it's been explained, it's like really the only treatment is nutrition, like supplements, things that can be either derived from natural sources or supplement sources.
Sure.
So it all comes down to nutrition, basically, right?
So in terms of primary preventing you from getting macular degeneration or preventing
or slowing it down.
Yes, all the treatment we have is for the advanced stages right now.
Right.
So yes, nutrition and lifestyle. So nutrition is one, but lifestyle, as I mentioned, UV protection, not smoking, getting exercise, having good blood pressure and cholesterol, those things.
So my question is then, like, are food allergies or food intolerances, is that something that an individual, like, is that any part of a consideration for formulating, getting your proper nutrition and all that? Like, if you do have food intolerances, is it something that's a factor?
Well, I don't think it's something that's been studied specifically, but sure, if you're allergic to some of the major constituents, then who knows, maybe. But it's not something that's been studied because I imagine the population of patients like that is probably small.
Thank you.